I want to, first of all, I just want to start by saying I'm not sure that Dr. Momin is a front man. And I've been here for a week visiting the site, and he has done such an outstanding job of providing the leadership and hosting us and really being very transparent about the work, where the problems are, where the successes are, what the timelines look like. And so Portia and I are just very, very pleased. And I also want to thank the team who've made this possible. You all have been so gracious and so helpful. So Dr. Momin, thank you for everything. Okay, so my job today, you are going to hear from Portia. Right. Portia could have gone first, but it doesn't matter. But Portia is the scientist here. I'm more the program person, the strategy person. I'm the one, along with the PI, Dr. Whitney, who works with the Gates Foundation to make sure we continue to have this investment. It's the network and the program office staff, particularly people like Portia, who make this happen day to day. So I'm gonna talk about CHAMPS and its framework and our strategy, and then Portia's gonna talk with you about the results of CHAMPS. And so the focus here is to build knowledge, and our ultimate goal is, for everybody in this room, is to save children's lives. And we're gonna, talk about the overview, the results, the new directions. So let me start with the first slide here. I think that everybody would agree in this room that too many children under the age of 5 die from preventable causes of death. And CHAMPS was established to provide accurate and definitive data for childhood mortality. That's really the purpose of CHAMPS, okay? That's what the vision is. And what we've seen is that the largest burden of child mortality happens in places with little or to no information about the causes of death. And so with our work with the Gates Foundation, we've really been focused on South Asia and in Africa. And so I think that many of you, as scientists in the room, are most familiar with the models that have been widely used to understand the causes of death. And it's based on, it's not that we don't have any information, the information is imperfect. So we know that many deaths occur out of the hospital or shortly after a short stay. And we know that diagnostic tests are not widely available. We know that verbal autopsy is used, but isn't specific enough. And we think about the cause of death as being a single cause. And we can tell you from CHAMPS, and Portia's going to tell you this, that isn't the case. Okay, so our overall objectives, and I want to tell you, I joined CHAMPS in 2019. So CHAMPS started in 2015. That's when the Emory University, the PI then was Dr. Jeff Copeland, who's very well known, previous CDC director. So he was the original PI, and this was presented as the overarching objectives: to track definitive causes of child mortality in sites throughout Africa and South Asia, with a real focus on using minimally invasive tissue sampling to produce and disseminate high-quality data to help inform policy and public health action, which Portia, again, is going to tell you more about, and then to enable sites to take the investments that we've made in the infrastructure to prevent mortality, to really focus on data to action. So this is where we are at. These are the sites within Africa and South Asia. You can see here we have 9 sites. As Momin was saying, Pakistan is our 9th site. So Pakistan is very early in its development as a CHAMPS site. So Pakistan is doing well, doing very well. And you can see here we have 9 sites, but it's important to recognize, and we in the program office need to do a better job of this, we have 20 catchment areas that are currently performing MITs. And we're ready to launch in Bauchi, Nigeria. So gives you a sense of where the surveillance activities are. We're restricted to work in South Asia and in Africa, and I can answer questions about why that is the case, but that is our directive from the Gates Foundation. And this is a really important slide because one of the things that you wanted us to talk about is partnership. And so when we set up CHAMPS, you can see here, Bill and the Melinda Gates Foundation is primary funder. You can see that we have in the US a CHAMPS program office. You can see that Emory University right now is our administrative home. IOMFI is the group that works very closely with the public health institutes around the world. The Centers for Disease Control, we work very closely with their laboratory, a couple key laboratories. And then the Task Force for Global Health is critical in that it is where all our informatics happen, okay? And then you can see the sites have done a great job in terms of pulling on partners, pulling together partners to implement CHAMPS. We also do have a global partners board with representation from various leaders and experts around the world. One of the things that I want to make clear, and I'm sure the Pakistan team gets this right now, this is a difficult project, okay? My background, I worked for the Centers for Disease Control for 19 years. I worked everywhere in the agency. I used to, in various leadership roles, we invested in a lot of work in the States and in globally. I have never seen anything so difficult in my life, okay? So it is amazing that we are able to do this work. And quite honestly, we think about CHAMPS is a global good. And in the 9 years that we've been in the field, we're in our 10th year, we've made exceptional contributions to the world's understanding of child mortality. And the network functions really well. But let me tell you about what it takes to launch this type of effort. So first of all, Momin talked about this, is working with families, working with communities is just critical. We can't do this work without building community trust and partnerships. We need to have a good understanding of local cultural practices. The staff across the network have to learn how to work with grieving families in this is very sensitive time where they've lost a child. And in many regions, and we understand this in the program office, that we have to adapt and to accommodate the cultural practices. The lab and clinical capacity is a big, big component of what we do in CHAMPS. And what we've been able to do in many of our sites is to build laboratory infrastructure. And again, Portia will talk more about that. There were few trained pathologists. There was not a lot of practice in terms of postmortem examination. You all know this, working in the clinical sector, medical records are often incomplete and missing, and not a lot of resources for postmortem diagnostics. In addition, we need a lot of analytic capacity, and so we are building that capacity not only at the site level, but at the program office level. So it's critical that these pieces are in place. And most important, are partnerships with the ministries of health or the hospital systems across the network. we are also think about CHAMPS, and this is going to be is a big part of our work now, and as we move into the future, is that the data empowers people and organizations to act. And this is a very nice slide that really speaks to how we're working with families, how we're working with communities, our work with health facilities and doing mortality reviews with clinicians. It is important to note that this is a very important academic collaboration, and that the data, the CHAMPS data, is openly available to the academic community and to partners. So you need to know, that's an agreement we have to come to with the Gates Foundation. We can't collect this data, keep it in a safe, and not share it with anybody. So it's always available on our website. Coordination with public health is critical. Portia will talk about the work that we do with ministries of health and public health institutes. We work closely with WHO. We've been working closely with PEPFAR on pediatric AIDS. We've been working closely with various modeling groups around the findings of CHAMPS. So right now, phase 1 began in 2015, and so we're right now in phase 2. Phase 2, we did add a couple new sites. We started to do much more work around data to action. Really, phase 1 was around proof of concept. Could we actually do this work? I mean, there are many that believe that this wasn't work that was going to be we're going to be able to do. And then we're moving into phase 3, and that's part of why we're here this week, is that starting in July of 2025, we're going to start a new project period. So what I really love about this work is that the Gates Foundation had a long-term vision for CHAMPS. And the concept was that we'd fund CHAMPS for 20 years. Highly unusual, in my experience, to have that type of investment for the kind of work that we're doing. So the objectives have changed a little bit, but they're similar. Going to focus on identifying and tracking definitive causes of stillbirth and child mortality in Africa and South Asia using MITS and cutting-edge diagnostics. We're very, very focused on the timely dissemination and communication of CHAMPS findings for health practice, planning, and policy. The objective 3 is new, which is to use the CHAMPS network in collaboration with key partners like yourself to implement and to investigate and test data-driven interventions to reduce mortality, to reduce maternal and child mortality. And then objective 4, we have a directive to make this program more efficient. This is a really expensive program, and to invest more in network excellence, to accelerate progress and program impact. So I'm going to share with you a little bit. We just finished the grant. It's at the Gates Foundation. I'm expecting agreement from them by November for the next 5 years, so we're very fortunate to be working with Pakistan and the other sites, but we will be continuing. So just to keep that all in mind, this isn't going to end in the next couple years. So what's new? So Portia will be working on increasing our support for our work with ministries of health and public health institutes, and working with other key partners to ensure that CHAMPS data is disseminated and used. The important operative word is that CHAMPS data is being used. We'll be expanding our data to action activities. We also are going to start doing more work around evaluating the causes of maternal death or deaths. We need to do some improvement in terms of our data collection efforts, our diagnostic systems. Most likely we'll be doing work to incorporate AI methods in our work to streamline our decode process. We're thinking about applying AI to our verbal autopsy process. We're also going to spend a fair amount of resource into doing a better job of using the CHAMPS data and using this expanded data set. And so we're given some thought in terms of building a larger analytic team that will be both in the program office and in the field. We have a wonderful platform. Network is a wonderful platform. They work well together, and so the CHAMPS program is a program that Gates looks to in terms of being able to evaluate interventions such as vaccines. And we're going to do more work in terms of a detailed examination of how deaths we enroll represent all the deaths in our communities, countries, and regions. And then finally, we're going to have a finer focus, an enhanced focus on network excellence. We're looking at a possible new site in Central Africa. We think that there's an opportunity here to create a CHAMPS-light model so that the methodologies that we have can be used by other ministries of health, other countries around the world. So that is going to be an area of focus. The network is going to have priority areas where we have network working groups. And then in phase 4, we've had a long discussion with the Gates Foundation about this. The program office is going to work to move. The U.S. office is going to work on transforming and transitioning the program office to Africa or South Asia. And then we, as a Western institution, will fade into the background. We'll be there for technical assistance and support, but the operation will be moved overseas. And that's the vision. That's the vision that we're working with. In addition, on the CHAMPS platform, we're well positioned to add on research or data action projects. And then finally, we have moved into a stage where we're looking for co-funding to help support both the core operations and added projects to the CHAMPS platform. So those are the new things that are going to happen in CHAMPS in phase 3. So I'm going to turn it over to Portia. She's going to introduce. You want to introduce Portia again? You can introduce Portia again. And she's going to talk about our results and our findings and the good work we're doing in data to action across the network. And then I gather we'll be open for questions. So thank you very much. Yeah.